So exercising with health complications from diabetes or other sources can make it a lot more difficult. I just want to cover the ones that are basically related to diabetes and just give you a few important tips about those. So the most common diabetes complication is peripheral neuropathy, or basically a loss of sensation in the feet and possibly the hands. And why this matters is that it can affect the way that you walk and balance, your gait, your stance, and make it more likely for you to fall. So if you do have peripheral neuropathy and you've lost a lot of feeling in your feet, you might want to at least put in some non-weight bearing activities like stationary cycling instead of walking, or aquatic activities, and make sure that your feet are not being irritated by your footwear. Wear socks that keep your feet dry. So any athletic socks, not pure cotton, but the ones that whisk the moisture away, are really good. And make sure you inspect your feet on a daily basis, which if you can't see the bottom of your feet well, you can put a mirror on the floor and hold your foot over it so you can see the bottom, but definitely do that. Some of the other complications like central nerve damage or autonomic neuropathy can affect how your heart responds. And that can be a problem if you have a high resting elevated heart rate or pulse, so it's above 100 at rest, and then also be blunted during exercise. So if you have any of those symptoms, please check with your healthcare provider about what would be safe and effective exercise for you. Also make sure you stay hydrated. A lot of people with diabetes actually have some type of cardiovascular disease, so if you have signs or symptoms of that, definitely get checked out before you get really physically active. But you could still exercise with it. You just might need to be more careful. If you get chest pain when on exertion, you're supposed to keep your heart rate at least 10 beats per minute below that. Resistance training, interestingly, doesn't actually have as big of an impact on the heart blood flow. In fact, it improves it compared to cardio training. So that's also something to consider. If you have some of the other complications like hypertension, just try not to do breath holding and super intense workouts. If you have some of the eye diseases related to diabetes, specifically proliferative retinopathy that's unstable, then you don't want to do breath holding or activities where your head is lower than your heart, a lot of jumping, jarring types of activities. And finally, if you have kidney disease, you can still be active. It may drain you of some of your energy, but even for people who have to go through dialysis treatments, they can sometimes be moderately active during the treatments themselves, as well as outside of it. So there are ways to work around most of these complications, and you should definitely look into some resources to find out how to do that effectively for yourself.